Welcome to the Vision Quest video series, a step-by-step guide to holistic health. Hi, my name is Toni Gallardi. I'm a psychotherapist, talk show host, and writer. I've been working with people in adult transition and crisis for about 15 years. I did a talk show for 2 years called The Toni Gallardi Show that interviewed risk takers, people who had left chaotic lives and passioned their lives with brand new vocations. And then I went on to start a book called Lifequake, which is all about a 7-stage map to a whole new way of being an adult.
In this program, we will discuss the origins and techniques of hypnotherapy, a trance-like state induced by a therapist to bring about physical or mental changes in a patient.
Somewhere between wakefulness and sleep is the state of consciousness that hypnotherapists use to try to improve a person's health. Hypnosis is a trance-like state that is induced by therapists, similar to the one that occurs spontaneously in sleepwalking or daydreaming.
There are different ways how different scientists explain hypnosis, and I guess one of them is that hypnosis is an altered state of consciousness, and that's the basis of the explanation. It's very different from your normal awakening state, and you go into a basically you create an inner world, an inner reality, which has nothing to do with the outside reality. So according to one definition, it's an altered state. There are other researchers who believe that hypnosis is nothing else but a goal-oriented behavior by which the person who is hypnotized wants to be hypnotized, therefore we produce those behaviors which are considered hypnotic, namely the hypnotic, just some of them, the hypnotic amnesia, the hypnologic, the changed time perception, time distortion, some kind of motor behavior which people usually produce in hypnosis, etc., etc. According to other definitions, they bring in the interaction between the hypnotherapist and the client. So the definition then goes that it is like a structured communication process between the hypnotist and the client. And it's nothing else but that. Like, it's not an altered state of consciousness. Like, the main split between different definitions are whether hypnosis is considered an altered state or it's not.
During hypnosis, an individual can perform tasks efficiently, avoid hazards, obey instructions, or speak lucidly. A hypnotherapist uses a hypnotic state to bring about physical or mental changes in a patient. Such changes can include healing physical illness, reducing pain, inducing relaxation, and gaining insight into present difficulties and past events that may have bearing on them.
Well, clinical hypnotherapy would be a psychotherapy method by which the clinician used the hypnotic state, the hypnotic phenomena, as an avenue, as a channel to go in and help the healing process. What occurs in clinical hypnotherapy is the hypnotic state is used for healing. The hypnotic state can be used for all sorts of purposes, but in clinical hypnotherapy, we create or induce a hypnotic state, which is then used as the channel of healing and restructuring.
There is no question that hypnotherapy can successfully treat many problems which may include skin disorders, migraines, peptic ulcers, irritable bowel syndrome, anxiety and stress, hysteria, insomnia, and many phobias such as fear of heights, exams, air travel, etc. Usually, patients who undergo hypnotherapy gain self-control from reliving and coming to terms with past emotional or traumatic events. The confidence often gained by hypnosis can ease difficulties in relationships, help control bad habits such as smoking, or give some help with drug and alcohol addictions.
There are three different styles of hypnotherapy. There's clinical hypnotherapy, which is the type I practice, and there's forensic hypnotherapy, and there's stage hypnosis.
And how are they, what are they and how are they different?
Well, the stage hypnosis is that very dramatic one when people run around like chooks. And that depends on the magnetism of the person doing it, the willingness of those who wish to run around like chooks, and their ability to be hypnotized very quickly under rather unusual conditions. So that's the combination of that. That's that. Forensic hypnosis. With forensic hypnosis, you can get somebody very, very deep. It's so deep that you can actually cut them open and perform an operation without anesthetic. Clinical hypnosis, which is what I do, is not quite as deep as that, although I can get people pretty deep, and I use it for, for migraines, emotional problems, pains, all sorts of things.
Centuries ago, medicine men, shamans, and priests of ancient Greece were said to have had hypnotic powers to treat bodily and mental ills. Modern Western hypnosis officially began with an Austrian doctor, Franz Anton Mesmer, during the 18th and 19th centuries. Mesmer's investigations into the natural phenomenon of magnetism led him to believe that everything in the universe is connected by an invisible magnetic energy field. When this field is distorted in a human, Mesmer believed that this was when ill health occurred. Mesmer found that by using magnets, he could restore the proper balance of fluid in the body and cure illness. His patients would be placed into a trance as Mesmer, holding an iron rod, would practice his magnetism on them. However, later in life, Mesmer's practices were scrutinized and no scientific evidence was found to substantiate his claims. Mesmer was labeled a charlatan, and his treatment faded from the medical scene. Today, modern investigators believe that it was Mesmer's powers of suggestion over his patients that cured them. It was not until the later 18th century that James Braid, a Scottish surgeon working in Manchester, England, revived the technique of mesmerism. James Braid coined the phrase hypnosis, from the Greek word hypnos, meaning sleep. Other practitioners were, at about the same time, also making use of hypnotism as painkillers. In the 19th century, James Easdale, a surgeon from Calcutta, India, performed many operations using hypnosis as an anesthetic. At the turn of the century, the British Medical Association examined hypnotherapy and disapproved it. It was not until about 50 years ago that hypnotherapy was finally revived. Nowadays, practitioners see a hypnotic trance as a good healing state that allows the mind and body to achieve calmness and tranquility, in which changes can be created which would otherwise be inaccessible in a fully conscious state.
There are a lot of research and search happening in this area to figure out what really hypnotizability is and what it depends on. The so-called absorption characteristic seem to be important, like how one factor you can predict kind of whether someone is hypnotizable is how well they can be absorbed in a book or a movie or in music. So how much are they able to really go into something so that the world stops around them? That's one thing. Other thing which you notice that people who are usually flexible in their thinking, not the left and right hemisphere dominance, like it's not about dominance, but the people who tend to be more, or sometimes at least more right hemisphere oriented and more flexible, more creative, are better in hypnosis, and they can hypnotize themselves or allow a hypnotic process to occur more than people who are very highly structured, very kind of critical, very head-oriented and rigid about that. They're usually more difficult to hypnotize, or you really have to choose your induction method very well. Obviously, trust matters a lot, whether they trust the hypnotist, what the environment is like, whether people can allow themselves to go into a process, how safe they feel. Children, as a general rule, are very easy to hypnotize because they're very close to that state where you spend your life in hypnosis, and it's a trance. Like if they start playing, then nothing else exists. They are in a hypnotic trance. So children are very easy to hypnotize. Later with age, after a certain age, it doesn't change. Like if you are, let's say, highly hypnotizable by the age of 10, 12 or after, then you stay like that. So with age it doesn't diminish your hypnotizability level.
How do you know somebody is under a hypnotic state?
You don't know.
Okay.
It's a very easy question to ask because nobody knows. There were several experiments done with the world's best known and best respected hypnotists, and they're unable to actually say when they're hypnotizing someone, or even as an audience, whether somebody is in a hypnotic trance or faking it. You never know. I mean, there are certain very rough signs you go after, but if someone is really good, you don't know. It varies. The most important variable would be how hypnotizable the person is. If the person is highly hypnotizable, then one session of hypnosis can achieve the goal, namely that he's going to be sleeping the day after, and the insomnia disappears. If, as the majority of us, the person belongs to the middle range, then it can take 1 to 10 sessions of hypnosis to achieve that. Like it's a teaching process then. If the person is low hypnotizable, belongs to the low hypnotizable group, then I wouldn't use hypnosis for insomnia. I would use some other methods. So it depends on how hypnotizable they are. It depends on how the symptom they want relief from. How long has the symptom been there? How intensive it is? How severe it is? How they relate to hypnosis? How they relate to me? What is my relationship to them? Other resistances or other helpful factors in their life. And basically you're asking the question, which nobody really knows the answer to, namely that when does anything in psychotherapy work and when it doesn't, and how fast it works. And unfortunately we don't really know. Well, what we did, the first part of the hypnotic process was the so-called hypnotic induction procedure. And what I used was the classical, the simplest way is the so-called eye gazing method, when the person just chooses a focus and looks at that spot, and so the the focus of the attention narrows in. And that's probably why it is effective, because it starts with a narrowing of attention. Also, a channel is established between me and him, so he keeps contact with the voice, with the sound of my voice, but his attention is more and more narrow. So the outside gets less and less important. And also aiding that whole process with a simple relaxation, which is not necessary for hypnotic trance, but in that instance, I thought it was a good idea to make him feel relaxed and have this kind of traveling inward process more. And then the second phase is the deepening phase, like you have your initial induction, and his eyes closed, so his body was relaxed. And then with the deepening process was with music. And also in the deepening process, I combined a dissociation of the conscious and subconscious mind, which is just a kind of theoretical split. It just simply means that I made him to have more access to a deeper level. And so the deepening was with music, which is lovely, non-threatening, pleasant. He likes music. Like you have to choose again the deepening method according to who you work with. He likes music. I know that that works well with him. And then you use kind of lovely imagery to send the music, picks up your mind and send it to a nice place where it can relax. So it's a bit like we did a dissociation between a more superficial level of the mind and the deeper level of the mind, where the defenses are not working and it's more open to take in a suggestion closer to the state where it's almost like you work in the raw material. So that was the deepening phase. And then when the deepening phase is over, I asked him, I started communicating with the finger methods, with the subconscious, first just to let me know, so I'm in communication with him and he doesn't have to talk. I could have chosen verbal method, but again, the verbal communication is closer to a normal conscious level, so I like to choose something else. Sometimes you have to talk, because if let's say, if someone is in the middle of a traumatic experience, I like to know what's happening. But this time it was okay. It's called the ideomotor signaling method, when you establish a link between your normal communication, the verbal level, and a body signal. And I could have chosen other body signals. That was just handy, and I have worked with him before with finger signals, so it's already established. And so that's an easy way to talk to the subconscious, to talk to deeper regions. And the only thing which we needed to do in this hypnosis was really just facilitate that process he's going through. So we didn't have to do actual more work on the grief, rather than just make the grief process go nicely, and possibly not too much resistance and not too much explosive material. And so that was the actual work part of the hypnosis. And then the hypnotic writing was when I asked the subconscious to leave a message for the conscious mind, which is good for the post-hypnotic state. It's like the hypnotic state is connecting now better and stronger to his normal life existence. He can always get this paper and have a good feeling knowing that, deep down in the deepest regions of his mind, he is being helped, and he's got this healthy core and it's helping him. And I use the hypnotic writing for that purpose, like having a little reminder, a little message. in a concrete form, not only in a mind level. You can use hypnotic writing for a variety of other purposes, like you can, if you do a childhood regression, for instance, then you can ask the little boy or the little girl to write you a letter and tell you what, you know, what are the worst things which happened to him, or you can get them to draw something in that state. So you can use it for all sorts of purposes. I used it now just to have that link. And then, so the next stage is when you're actually bringing the person out, and you really have to do that well. I mean, you have to do the rest of the process well, but maybe you can make mistakes in this phase more than you can in the previous phase. And you have to make sure that the person is going to feel okay after they come out. Sometimes there can be some residual drowsiness or headache. The post-hypnotic headache is a well-known phenomenon, so I made sure that he's going to feel okay, refreshed. I really had to make sure that this split between the subconscious and conscious mind is not going to be staying with him. So I have to make sure that he's back to normal, that he's not dissociated but fully integrated. So he needs obviously both levels of functioning in his everyday life. So I don't want him to walk out of here without his conscious mind. So you make sure that that reintegration happens. You make sure that you are gentle. You don't kind of explode them out of hypnosis, but you're gentle. You make sure that they are going to be out of hypnosis by the end, and there's not going to be any part of them which is still kind of hanging around. And then slowly, I use the counting back method. Again, there are millions of other you could use. I could have just said that your, the music brings your subconscious mind back, and now you notice where you are, who you are, and when I say you are out, you are out. I mean, it's not a very necessary step, but it's just one method. I got him to open his eyes at number 3 when I was counting back, because again, it's a more gentle way. Like first his eyes open. First I got him to feel his body on the chair, be aware of noises. Like it's all bringing him back in a more gradual, gentle way, more grounded way. And then by the number 1, he was out, and again I said, you're out of hypnosis, fully aware and awake, and back to your normal consciousness. In that bringing back phase, I also made sure that his fingers feel normal. Because if you are highly hypnotizable, and in hypnosis someone is suggesting that your finger lifts up easily when you say yes, and maybe it feels lighter. I mean, I didn't do much of that with him because he's already been there many times, but with a new subject, if I have a new person, then I would even touch their finger and make sure that that it feels different, that it feels lighter if they think yes. And so there is going to be a link between his finger and the yes answer. So when you bring them out, you make sure that their hand feel normal. They don't feel numb, they don't feel tingly, there is no signs of hypnosis left. So you undo the hypnotic suggestions before you bring them up.
And I'd like you to tell me, are you outside or inside?
Outside.
What is the environment like there? Can you describe to me what you can see?
It's very green and it's very open. There aren't trees, long grasses.
What is the temperature like? Is it hot or cold?
It's a cool, and it's so windy.
Mm-hmm. I'd like you to just breathe in the atmosphere there.
Cool and wet.
Mm-hmm. Look down at your feet. What are you wearing on your feet?
They're dark boots.
What are the boots made of? Pamela wanted to find out when she sort of had experienced a past life with her current partner, Philip, before, and that so she went back into the time in 1062 or something in Wales and so on. Now, as I said, Pamela just observed it as if she was looking at a television film, which a lot of people do. She's just observing and is quite interested in watching what was happening. She didn't reenact it, or not. She didn't re-feel it or re-experience it. So it was more of a detached observance. I guess she caught a glimpse of when she had met him before. There wasn't anything terribly dramatic or terribly interesting happening. Unfortunately, that's what happens, you know. You don't always get these incredibly fascinating past lives. Usually you get very ordinary, everyday past lives. Because, as I say, very, very few people were famous, or, you know, most of us have just been peasants or working people or whatever, you know, or tribal people. We haven't all been kings and queens. So I guess she saw what she needed to. I guess more will come when she writes about it later. I always advise people to go home and write about it, and don't censor the flow through the pen, because she will remember more. What we'll do is we'll just finish up, and I just want you to go to your death, and I want you to tell me how you died. Is it a natural death, or illness, or accident? Or how did you die?
Oh. Just being swallowed up by something like that.
Just go into it. I always end up a past life session with taking them to their death, at least once, at least one death, because that's a great way to finish up, because they go through their death. Then I ask them to rise up out of the body and look down on the body, and then I get them to tell me what the body's like and how they feel about the body. And they most times they're not even interested in looking at the body, or they'll feel a bit of compassion for it, or they're just sort of not that interested. They want to go on, and then I get them going beyond the body and into that more area of expanded consciousness, of moving into the light, and that's when I bring them out, so that when they come back with their whole being filled with light and filled with that expanded consciousness, which is a very nice way to re-enter the body. Had people go in between lives to very beautiful dimensions, and that's very interesting and enlightening, and people appear to go, people have passed over in great distress or illness, they appear to go into what, the only way I could say it, and pardon the terminology here because it sounds a bit corny, but like spirit hospitals, like hospitals in other dimensions where they're cared for and nurtured and their spirit becomes stronger, and then they come out, and then they're sort of like reunions with loved ones, and then they seem to move on where they go to like mentors or teachers, and who help them to assess what they've achieved in the lifetime before and work out what they want to do next and so on. And it's very, very interesting to go to the between lifetimes.
I helped with pain management quite a bit, with back pain, and I used hypnosis as a tool to achieve changes in the actual structure of the muscle or the actual body functioning around pain. I also used hypnosis with pain management in a way when there is chronic pain, then the person can live with the pain better, like that there is a process of dissociation maybe from the pain if it is helping, because sometimes you need to know your pain and it's not helping if you don't experience pain. I work a lot with trauma and I used quite a bit of hypnosis with Vietnam veterans with war trauma issues. I also worked with incest survivors, women who had really difficult childhood trauma around incest. I have used hypnosis as a stress management method. Often hypnosis is a part of everything I do. Like often I teach people to do self-hypnosis, and they can use different stress management techniques or anxiety management techniques. I used hypnosis with panic attacks. You know, when people have different difficult body symptoms in the middle of the shopping center, let's say, and they need some tools which they can apply there and then.
I guess they could keep themselves in a state to avoid the panic.
Yes, they can prevent panic when it starts. When panic has set in, it's very difficult to do anything because they feel helpless then, but they learn to recognize the first signs of the panic response, and then they can do a lot. Even with the anticipation process of the panic, often the problem is that they anticipate, and the anxiety is really about anticipating that the panic can occur, and you can work a lot with hypnosis around the anticipatory anxiety.
I put myself into self-hypnosis, in times where I need to stay cool.
Like now.
Yes, yeah. Although I didn't bother to now,
No.
but I mean, times where there's a bit of stress, I'll put myself into self-hypnosis, and nobody knows that I'm in hypnosis. Yeah.
I guess that takes a lot of training too.
Yes, you can put yourself into hypnosis and then just carry on normally, which I've done. I've done a few television shows recently, like the Trisha Goddard show and Extraordinary. I put myself into self-hypnosis because I was so nervous, but I was able to do it, but it was like doing it in a dream, but nobody would have known. So it comes in handy.
Well, I guess there are many precautions. The hypnotherapist really have to know what he or she is doing. Often in hypnosis there are spontaneous ebb reactions called when people just come up often in the first session of hypnosis with something which have an issue which have been buried and repressed for a long, long time. And now that they relax, and now that they given the permission, so-called, to look at that issue, it will explode almost out of them. There are accounts of, people manifesting multiple personality disorder in a first hypnotic session, for instance. So there are a number of things which can occur in hypnosis. You are dealing with people's deepest or deeper level of emotional reality, and anything can happen, anything can come up, and if you are not trained and if you don't know about psychopathology, then don't touch anyone. You really have to know what to do just about in every situation which can occur, because things can come up. So you have to be really trained in hypnosis, and you have to be trained in dealing with human beings in general.
As long as somebody wants to be hypnotized, they can be hypnotized. It's only if they simply don't want to be hypnotized, you can't hypnotize them.
A lot of people, I guess, are afraid of letting go and having that power. I guess what I'm getting at, people are afraid to have hypnosis. Some people are, because they think the power's going to be taken away from them.
They think.
Yeah, that's what I'm saying.
Yeah, that's right. That couldn't be more wrong. because they remain totally in charge of everything the whole time. They don't think, say, or do anything they wouldn't say or think or do normally, and all they have to do is open their eyes. You know, I mean, unfortunately, there's a great misconception about hypnosis. It's not like what people think. You know, it's not, you know, somebody else having power over you or losing your power or anything like that. Yeah.
Many people have that fear. That's why it's so important that before you start hypnosis, you discuss what hypnosis is and you choose the right induction method. Like with somebody who's afraid of losing control, I'm not going to use any direct demands in my suggestions, but I will emphasize that they are in control. They will only take in what they want to take in from my suggestions. I will use much more indirect methods in my wording. I will assure them that they will never lose control, because the truth of the matter is that in hypnosis, they don't lose control if they don't want to lose control. They know throughout the whole process what is happening. They well aware of what they say and what I say. They don't do things they don't want to do. I can't get them to be an instrument of my will and do all sorts of things they would otherwise oppose to do. So there is no losing control process in hypnosis.
Oh, well, the medical opinion, I think, basically is okay, because a lot of doctors and psychologists are also hypnotherapists, you know, and psychiatrists, you know, they do hypnosis as well.
I guess it depends on the actual application of hypnosis, where maybe the medical community would clash with non-medical community, because they obviously want to keep the method for, you know, traditionally accepted and sort of safer areas. Like they wouldn't go into past life therapy and all that, or more esoteric applications. But as far as, you know, a GP's practice is concerned, or even psychologically, you know, scientifically accepted areas like anxiety management, etc., hypnosis is well received and accepted as a valid method.
The thing is, most of, if not all, our physical ailments stem from emotional, mental sources, you know, feelings, emotions, everything. And so if we can get into that subconscious, unconscious mind and access that, the source of where it all started from, the very young child, the first time it felt the hurt or the anger or whatever, if we can access that and access the hurt child on a subconscious, unconscious level, and encourage the adult unconscious person, the unconscious adult, to help the unconscious child to release its hurt or anger or whatever it is, then you've let it all go and healing takes place. You can prevent all these cancers and arthritis and everything that comes as a result of stored up anger and hurt. We can prevent it by working on that subconscious, unconscious level and releasing it and letting it go. And I'm sure that more and more people will realize that there's no point in just treating the effects with drugs. You're better off getting the cause and releasing it in a very natural way, in the same way as it all started, really, which is attacking it at the subconscious, unconscious level.
Well, I think it's going to become less and less mystical in terms of the belief people have about hypnosis. Hopefully people will understand more and more about, you know, that hypnotic phenomena is just something which happens to all of us and we can all induce it ourselves. So it takes out the airy-fairy sort of connotation hypnosis takes that out of the whole area. And I think that it's always going to be used as a very effective tool for a quick and powerful impact on our emotional or physical life.
The state of hypnosis induced by a qualified hypnotherapist can tap into many emotional and psychological problems, allowing the mind and body to heal itself.